What if I told you, not every cough means your pet is dying, but also ignoring some coughs can be deadly? Confusing? Welcome to the wonderful world of coughing in dogs and cats, where sometimes it's nothing, and sometimes it's your pet quietly asking for help. Today I'll show you when you can safely deal with the cough at home, but also when you absolutely must see the vet, and how not to panic every time your dog sounds like he's trying to cough up hairball, which doesn't exist. Let's get into it. Hi everyone, I'm Martin. I'm your friendly neighborhood vet, and this is DrVet. On this channel, I help pet owners understand what their pets are really telling them before small problems turn into the big, expensive, scary ones. And today's topic, coughing. It's one of the most misunderstood symptoms I see in the practice. Dogs cough, cats cough, owners panic, Google screams cancer, and suddenly everyone's stressed. So let's slow things down and explain this properly. What is a cough in simple terms? A cough is not disease, it's a symptom. It is the body saying, hey, something doesn't belong here. What coughing tries to do? Clear airways, remove mucus, respond to irritation, protect the lungs. Think of it like your pet emergency cleaning system. Dogs coughing much more commonly. Cats cough less often, but more seriously. In cats especially, coughing is often mistaken for vomiting or hairballs. Spoiler alert, most coughing cats do not have hairballs. Yes, I said that. In dogs, we've got kennel cough, infectious tracheobronchitis, that classic goose honk cough, dry harsh cough, often after kennels, groomers, daycare. Dog otherwise bright and eating. Annoying? Yes. Usually dangerous? No. Dramatic sounding? Absolutely. Another one is tracheal collapse, mainly in small breeds, like Yorkshire Terriers, Chihuahuas, or Pomeranians. Those dogs coughing when excited, pulling on lead, or being picked up. Yes, heart can cause coughs, worsen at night, exercise intolerance, older dogs, sometimes fainting. This is not one to ignore. Another one is foreign bodies, like grass seed, sudden coughing after walk, acute onset, distress, pawing at mouth. Cats, pay attention here. Feline asthma, very common and very mixed. Cats cough low, stretch neck, cough repeatedly. An owner says he's trying to be sick. Cat says, I cannot breathe properly. This one is serious. Another one, respiratory infection. In kittens, rescue cats, typical symptoms are sneezing, coughing, or eye discharge. Heart disease. Yes, cats have it too. Cats are masters of hiding heart problems. Coughing may be the only sign. When is safe to deal with it at home? Generally, it's safe if all apply. Pet is bright and alert, eating and drinking normally, mild cough, no breathing difficulties, no fever or no lethargy. Safe home care, first aid only. Notice I said first aid, not treatment. What you can do? Rest, no intense exercising, harness instead of collar, humid air like bathroom steam, avoid smoke, spray and candles, and good hydration. What you should not do is human cough syrup, honey for cats, leftover antibiotics, or waiting to see if it passes for a few weeks. If cough lasting more than 5-7 days, this is the time to call your vet. Red flags. Do not wait. Rapid or labor breathing, blue or pale gums, collapse, severe lethargy, coughing blood, cat coughing, almost always, puppy or kitten cough, known heart disease. If your pet looks like is working hard to breathe, this is emergency, not a Google moment. Many owners delay visit because they are scared of test and high cost. Let me reassure you, possible vet steps: full examination, listening to the chest, temperature, x-ray only if needed, blood tests sometimes, heart scan if suspected. Often we don't need everything, just the right thing, and early diagnosis is always cheaper and safer. Let me tell you the true story. A dog came in coughing dramatically. Diagnosis? Well, owner vaping next to the dog. Dog stops coughing, owner stops vaping indoors, and everyone lived happy ever after. And another one, a coughing cat with hairballs. Turned out to be asthma. No, everything is cancer, but not everything is nothing either. So remember this, coughing is a message. Your job is to listen. Not panic, not ignore. If this video helped you, please like it. It really helps the channel grow. Subscribe to DrVet so you don't miss the next episode. Because next time we're talking about anal glands. Yes, smelly, awkward, and ignored. And trust me, you really want to understand those. I'm DrVet. I'm helping you to help your pet. I'll see you next one.